Hi, my name is Hajara Begum Shuma. My student ID number is N41383318. Today I'm presenting contemporary health issues. Introduction. There are many contemporary issues in health care and social care. Identifying the issues, finding out the impact of those issues, and solving those issues are very critical for the people in the UK, so that quality of care can improve. Contemporary issues are many issues such as the COVID-19 pandemic and the implementation of Brexit, workforce shortage in the health and social care service. Along with this, there is a huge old age population in the UK, and it will create a damage for more healthcare service. The rate of mental disorder is very high in the UK among the countries of Europe. According to NHS, there is a problem of understanding in the health sector in the UK. Beside, there is a huge old age population in the UK in 2019, and it will create a demand for more healthcare service. The rate of mental disorders is very high in the UK among the countries of Europe, and according to NHS, there is a problem of understanding in the health sector in the UK. Addressing these issues is very critical for the improvement of the healthcare sector, because all of those issues are impacting the healthcare sector service. Huge and major 2020 impact of the COVID-19 pandemic on health and social care. In 2020, COVID outbreak has made the whole world stuck, and there is a strong impact of COVID-19 in the UK. There are many people who have died of COVID-19. The infection rate and the death rate were too high, and the doctors and nurses were become infected handling patients with COVID-19. All the affection healthcare resource, the pandemic also brought long-term health consequences. There were many new technology to provide healthcare service. Telehealth service was also introduced to reduce the pressure on the resource of healthcare. The description of the vaccination has presented multiple challenges, such as a logistic to search the area and completed vaccinated. So workforce shortage in the health and social care. According to the statistics in 2011, there were 9.2 million people who were more than 65 years old. Statistics to 2019, and in 2021 their number became an 11 million. So this is shift in democracy demands more healthcare facility. Along with this, there are many other issues like mental health disorder, mental health problems in another big problem in the UK. In Europe, the UK has the highest rate of mental health disorder. According to the statistics, 25% of the population face mental health crisis, and this problem become a chronic problem in modern days. Mental health disorders also impact the economic. Mental health crisis disorder productivity and effectivity of the workforce is also a resource for dependency in the workforce. Impact on care delivery. There is a huge number of again population. They have created a huge demand of healthcare service, as there is a definitely is the workforce. So managing the demand of healthcare is very thought. The existing workforce is facing the increased workload, and this workload leaded of stress and burnout. Along with there is older adults often require treatment for the chronic conditions. Addressing workforce shortage. Workforce shortage is causing many problems in health and social care. So addressing this problem is very important. So solve the problem to workforce. The only solution is to recruiting new employee and new talent in the healthcare sector. Along with this, there is must some development and training program. The existing employee effectiveness, and there must be a policy to support health and healthcare works. Hypothesizing outcomes. Addressing the problem of workforce shortage has led to some positive outcomes by improving recruitment and tensions. There will be a strong and stable workforce. There will be improved and proper care for the patient, and this improved service increase the patient satisfaction. Along with this, it will be very helpful for the well-being of the staffs. All this will help to make a suitable healthcare workforce that people will want to join. Implementing solutions. To implement the solution, there must be some collaboration with educational institute, and along with this, there must be a supporting work environment. Digital infrastructure is very important to provide efficient service and increase customer satisfaction, but there are some barriers, and this barrier will hinder the speed of digitalization. The cost of digitalization is the first barrier. A huge investment is needed to implement digital technology. The National Healthcare of of the UK is unfunded, and in this situation it is a very tough to implement digital instructed. And the second barrier is resistance to change. There should be some improved policy that will make a better work condition. Conclusion. In the UK, there are some contemporary issues such as the COVID-19 pandemic, Brexit, and workforce shortage. Their issue are the barriers to providing improved health care in the UK. To solve these issues, there are ways such as a patient-centered care and digitalization in the health care sector. Those approaching are very effective and efficient in achieving those goals, and it will be providing to good quality service to the patients. Government intervention to implement with approaching will be effective, and all the stakeholder and all the make the whole things within less time. All the stakeholder and the government should work together to overcome those barriers and drive continuous improving in the healthcare sector, so that patient care quality increase and staff are able to work together to best their ability. Thanks for listening my presentation.